All right, thanks, Ryan. 1 in 11 adults in the U.S. will be diagnosed with a kidney stone at some point in their lifetime. The summer heat actually can make the people prone to getting kidney stones more. And if you've had one before, you know how much pain they cause. Joining us to discuss all of this is Dr. Shreck. He is a urologist with Hartford Healthcare's Tallwood Urology and Kidney Institute at Midstate Medical Center. Doctor, welcome.
Thank you for having me.
Great to have you. So how does the summer heat put someone at risk for kidney stones?
So there are environmental factors that increase the risk for kidney stone formation. Geographic areas with hot, dry climates tend to have a much higher proportion of patients who form kidney stones. Occupations with exposure to excessive heat and conditions that promote dehydration are associated with increased stone risk. So patients have to be very careful in the summertime.
All right, what are some of the signs and symptoms of kidney stones?
The majority of stones form in the kidney. When stones actually sit in the kidney, they usually don't cause any pain or trouble. There is a small tube called the ureter that drains urine from the kidney down to the bladder. And sometimes kidney stones can move and get stuck in the ureter. When this happens, the stone can block the flow of urine, analogous to stepping on a hose. When this happens, urine backs up into the kidney, causing the kidney to swell. This can cause patients to have flank or lower abdominal pain, sometimes groin pain. Nausea and vomiting are very common as well. Some patients may experience urinary symptoms, such as the feeling of urinary urgency or having to go to the bathroom frequently.
All right, doctor, how can people avoid kidney stones?
So kidney stones are very intricately linked to our diet, and without question, the most important factor to help prevent stones from forming is high fluid intake. Depending on your age, overall health, and other medical conditions, it's typically recommended to drink 64 ounces of water daily, or about half a gallon, which is certainly a lot of water. This is especially important in the summertime, where the heat can promote dehydration. Another important dietary factor in stone formation is sodium or salt intake. High salt intake can actually promote the formation of kidney stones. Avoid adding salt to foods, and be wary of processed foods that may already have a lot of salt in them. Certain foods are also high in something called oxalate, which is found in a lot of kidney stones as well. High oxalate foods include things like beets, nuts, spinach, tea, and chocolate. So just everything in moderation.
All right, doctor, 15 seconds. What treatment options are available?
So often if kidney stones are small, patients can easily pass them. When they are large, there are a variety of surgical techniques to remove them. We use minimally invasive techniques to remove kidney stones, which are same-day surgeries, allow for expedited recovery for patients.
All right, urologist Dr. Shreck with Hartford Healthcare. Thank you so much. Great information, especially in these summer months. We thank you, doctor.
Thank you for having me.